past several years, we have learned that the patient's room and areas in the hospital where the patient goes have an impact in spreading healthcare-associated infections. The patient rooms and other areas in the hospital, for example, the X-ray department, procedure rooms, and exam rooms, to name a few, could have contamination from bacteria and viruses. Environmental management service is important in providing a clean and safe healthcare environment to help reduce the risk of illness and infection. Hand hygiene, such as traditional soap and water hand wash or use of the alcohol hand sanitizer, is the leading thing you and I can do to prevent infections in the healthcare environment. But we've learned that without a clean patient room environment, hands will quickly become recontaminated, even with strict hand hygiene programs. Germs survive in dust and on floors, bed rails, telephones, call buttons, curtains, light switches, and other room and hospital surfaces. Patients are surrounded and exposed to hospital surfaces and medical equipment that may serve as a home for the germs that may cause healthcare-associated infections. Clearly, environmental management service is a critical line of defense in the battle against healthcare-associated infections. Cleaning and disinfecting the healthcare environment is not a simple or easy task. EMS and infection prevention and control, working together, as well as other partners, results in improved patient outcomes and reduced healthcare-associated infections. The Environmental Services Sanitation Procedure Guide that we talk about in this video can be used as an example for each facility to develop and promote step-by-step instructions for cleaning and monitoring to ensure an effective cleaning and disinfection process. The practice scenes in this video are based on the Environmental Services Sanitation Procedure Guide to lead you in cleaning the same way, the right way, all the time.
Today's VHA housekeeping personnel are required to be skilled or competent in a number of areas. Some of these areas include chemicals, supplies, equipment, processes, safety, universal precautions, HIPAA and patient confidentiality, patient sensitivity, and patient-centered care. Our EPS mission statement states that we are to honor, comfort, and protect veterans by developing and guiding innovative improvements in healthcare environmental sanitation, textile care, interior design, and waste management programs that exemplifies VA's core values and characteristics, while our mission statement affirms that we should continually enhance VHA's ability to create healthy, healing environments for our nation's veterans and their families that inspire, enable, and sustain their health and well-being. Housekeeping personnel are required to maintain some of the most demanding and high-use environments. To meet this challenge, VHA healthcare cleaning programs are built on a foundation of infection control, safety, quality, and a highly trained workforce. As mentioned before, the scenes in this training video are based on the EPS Sanitation Procedure Guide. The guide can be used as an example for you to develop your facility's standard operating procedures for methods of cleaning and quality assurance. Universal use of the procedure guide will ensure that guidance from the program office simplifies and standardizes the cleaning and disinfectant process throughout VHA. And it will also ensure the most up-to-date infection prevention, control measures, surface cleaning, and disinfectant practices are provided to the field. We, the Environmental Management Services staff, are the safeguard between the patient and hospital-acquired infection when we clean the same way and the right way every time. Working together, along with the consistent use of the guide, we will achieve the goals set forth in the video. You can find the guide on the EPS website that will be shown at the end of the video.
Hi, my name's Dwayne.
Hi, my name's Paul. We're here today to talk to you guys about the importance of cleaning frequently touched surfaces in a healthcare setting and to reduce hospital-associated infections.
Frequently touched surfaces are also known as high-touch surfaces that are commonly touched by staff and patients.
And as you can see, we're already in the room, but we would start with the door, starting at the door handle.
The high-touch surfaces at the doorway include the door handle and plate inside, light switch and hand sanitizer dispenser.
Before we talk about other surfaces in the room, remember it is important to use EPA-registered disinfectant cleaner to ensure surfaces are cleaned and disinfected effectively. Follow the manufacturer's instructions for the correct contact time or dwell time.
Frequently touched surfaces in the sink area include the counter around the sink, the faucets and handles, and light switches.
Also remember to change cleaning cloths frequently. Remember, it is better to swap out often rather than not often enough.
In the bathroom, high-touch surfaces include handrails, light switches, the bathroom sink including the faucets and handles, and the toilet, the flush handle and toilet seat.
High-touch surfaces can be found in acute care, outpatient ambulatory care, community living centers, and clinics in general. Cleaning and disinfection of high-touch surfaces apply to all patient care settings and includes patients in isolation precautions, as well as those patients who are not in isolation.
The path of cleaning and disinfection continues around the patient bed and includes these high-touch surfaces: the telephone, nurse call box, TV remote, bed rails, over bed table, bedside table, all handles, the chair, and the chair armrests.
The list of cleaning frequently touched surfaces can be quite long, so Dwayne here uses a list straight out of CDC.
The list includes items such as bed rails, tray table, call box button, telephone, room sink, and room light switch.
And remember, it's very important to clean the high-touch surfaces for patient care and safety.
The two-step process includes cleaning the surface to remove visible solid and liquid soils with a scrubbing action, and disinfecting the surface by applying the disinfectant solution for the recommended contact time. Please follow the manufacturer's instructions noted on the product label.
Hi, I'm Joseph Chapman.
And I'm Tanya Stoops.
Today we will be demonstrating the proper cleaning procedure of a contact isolation room.
The CDC recognizes 3 different levels of precaution rooms: the contact, airborne, and droplet precautions.
Today's demonstration will be a contact discharge isolation setting. Upon entering the room, it is important to check the contact isolation signage to assure you have proper PPE on. Today's demonstration requires gloves and gowns. It is important to remember to keep your cart parked outside of the room. The first thing Tanya will do is collect all soiled linen and dispose of into hamper. It is important to remember never to press down or compress the laundry bag. Then she is to roll it over for proper disposal. Next would be to collect the waste out of the waste receptacles. She is to tie all 4 corners of the bag, hold it away from her body, and carry it out for disposal. With a microfiber cleaning cloth and EPA-registered cleaner disinfectant, Tanya will clean all portions of the bedside table, including the top, the under compartment trays, the bottom, the upright bedpost, and the caster bottom wheels. After cleaning the overbed table, Tanya will raise the bed to a height favorable for cleaning for her. She will then clean the footboard with an EPA-registered cleaner disinfectant and her microfiber cleaning cloth. Next, she'll clean the headboard. After cleaning the headboard, she will remove and stack on top of the footboard. Then she'll proceed to cleaning both sides of the pillow and stacking that on top of the headboard. In continuing the 2-step process, Tanya will begin cleaning the top sides of the mattress. In addition, she'll do the sides, flip over the lower portion, clean the under compartment tray and the bottom of the mattress. And she would repeat this process at the head of the mattress as well. It's important to clean the bed frame, lower compartments of the bed, side rails, and caster wheels. It is important to remember that she is to change out her rags if they become visibly soiled. After cleaning the bed, Tanya will focus on the bedside furniture, cleaning the top, sides, and inside the drawers. She will then focus on the overhead light, the top, sides, bottoms, the pull cord itself, spot cleaning the wall, other equipment associated on the wall, the phone, horizontal surfaces, and the entire center console itself. It's important to remember she is to use a two-step cleaning process. First step is to clean all surfaces. Second step is to disinfect all surfaces. Tanya will visibly inspect the curtains to see if they're damaged or soiled, and she will replace as needed. In the real world, we would remove our PPE just before exiting the room.
And always remember to practice good hand hygiene before placing the linens on the bed.
Using the two-step cleaning disinfecting process, Tanya will first use an EPA-registered cleaner disinfectant to clean the overhead light, the mirror, shelving, the sink, the handles, the faucet, underside of the sink, piping, as well as the paper towel and soap dispensers. After cleaning all surfaces, Tanya will now disinfect. After cleaning and disinfecting, Tanya will use her glass cleaner to clean the mirror. Upon completion of cleaning the mirror, she will conduct a visual inspection of all areas and surfaces. Tanya will visually inspect the sharps container to assure it's not past the fill line. If the sharps container is full, she will close the liner and remove and replace. First, using an EPA-registered cleaner disinfectant, she will clean all surfaces of the sharps container. Next, she will disinfect. Next, Tanya will set out her wet floor signs and begin to dry mop the entire room. She'll be sure to dry mop underneath the bed and go corner to corner. Then Tanya will grab her microfiber mop system and wet mop all surfaces of the room. Using an EPA-registered cleaner disinfectant, Tanya will first clean all surfaces around the sink area, wiping down the mirror, the overhead light, the sink, the handles, the faucet, the plumbing fixtures, and underside of the sink. In addition, she'll wipe down the paper towel dispenser as well as the soap dispenser. Upon completion of the two-step cleaning process, she will grab her glass cleaner and clean the glass mirror itself. Next, she'll check the paper towel dispenser and soap dispenser to see if the product needs to be changed out. Now Tanya will flush the toilet to remove any loose debris. She will apply her EPA-registered disinfectant cleaner inside the toilet bowl. Next, she'll grab her EPA-registered disinfectant cleaner and begin to clean the handle, the plumbing, the seat, the top, sides, and underside of the toilet. She will grab her toilet brush and clean out the inside of the toilet. Upon completion of cleaning the entire toilet, she would go back and re-clean the toilet with her EPA-registered disinfectant cleaner. Cleaning of the toilet in an isolation room requires a two-step cleaning process. Step 1 is to clean the toilet of all visible debris. Step 2 is to disinfect and activate microorganisms. Tanya will continue to clean this isolation room bathroom by first cleaning the toilet paper dispenser, the handrails, the emergency pull cord, and the tiling around the toilet using her EPA-registered disinfectant cleaner. Upon completion of cleaning the walls and handrails, she will move on to the curtain to be sure to clean all visible soil and to disinfect surfaces second. In accordance to the two-step process, Tanya wants to first clean from A to Z to assure all visible soil has been removed, and next come back and disinfect the surfaces from A to Z to assure all microorganisms have been inactivated. After setting out her wet floor signs, Tanya will go into the room and dry mop all surfaces out. After dry mopping, Tanya will come in with her microfiber mopping system and will mop the room surfaces out with an EPA-registered cleaner disinfectant.
We're here to talk about cleaning a community living center room, or CLC. The steps used to clean this room are found in the EPS Environmental Service Sanitation Procedure Guide. Dave, what's the first thing we're going to do?
First thing I'm going to do is check for the signage for my proper PPE. In this instance, I'll only need my gloves. Before I put my gloves on, I would actually wash my hands and then don my gloves.
I'm Pete, and I'm going to do that, just like this. All right, what's the next thing?
We're going to knock on the door and identify ourselves. Housekeeping, it's okay if we come in and clean the room?
All right, let's go. Now the first thing Dave's gonna do when he comes in the room is empty the garbage. He can't just take that bag and dump it out. He's gonna actually replace the liner. Then the next thing he's gonna do is get himself an EPA registered disinfectant cleaner. He's gonna clean the garbage can inside and out. Then he's gonna do a glove change. He's gonna sanitize. There's your fresh gloves, Dave.
Thank you, Pete.
You got it. Dave is checking the curtains for soiled areas. If he sees anything, the curtains would come down, be laundered, and replaced. In non-isolation rooms, the curtains are removed to be laundered quarterly. The next thing Dave's going to do is clean the surfaces in the patient's room. He's going to do the bedside table, he's going to do the over-the-bed table, and the armoire. Now the thing about a CLC room is that the patients have a lot of stuff laying around. Dave's going to be careful to move the stuff aside, put it back where he found it when he's done cleaning it. If the patient's in the room, he's going to ask first. If he has any problem with the patient, he's going to get the nurses involved to enlist their help to get the stuff moved so he can clean the room. Dave's going to do the sink in the patient room now, and he's going to use a glass cleaner. He's going to work top to bottom, and he's going to clean the light, the mirror, the paper towel dispenser, and the soap dispenser. Then he's going to move on to the sink area. Now the thing about a CLC room is there's going to be lots of patient personal property laying around. He's going to gently move it out of the way. He's going to clean underneath it. Then he's going to